So we've got an hour together. It's not very long, but hopefully it'll be long enough. Liz is very kindly going to keep an eye on the chat for us. So any comments, I want this to be a real open session, a two-way. I don't want to be talking at you for a whole hour. So please feel free to comment, hands up, any questions, that's absolutely fine. So let's get started then, if that's okay. So you're in the right place if you're here for the improvement role in supporting team health and wellbeing. My slides are not moving. What are you doing? Oh. Oh, right, there we go. Okay, so guys, just a quick run through of how the hour is going to go. So we're going to do a really quick little check-in with all of us. Then I'm going to go through some health and wellbeing definitions from the NHS WHO, and then we're going to think about and have a quick discussion about how we would define health and well-being. Then we can have a quick whistle-stop tour of measuring health and well-being and whose responsibility is that anyway, so I'd really welcome your thoughts and feelings on that. And then very brief look at positive psychology, some interventions, and a little bit on flow. So as I said, so it is going to be a whistle-stop tour. I have popped lots of resources in that Liz will share with you, and it's on the slides as well. Okay. Right, so it's Friday, guys. We've made it almost. And I've got the post-lunch session, haven't I? So we're all probably feeling maybe a little bit tired, maybe. Hopefully this is going to get you re-energized. So what I want you to do, I want you to look at these lovely cats, and I want you to just think about, do a quick scan of yourself. How are you feeling right now in this moment? Okay, and feel free to pop it in the chat and share if you want. But yeah, how are we feeling this Friday afternoon, guys? Which cat represents your mood and vibe? Who's going to kick us off? If I'm honest, I'm a 9. Getting that tequila out, maybe, I'm not sure. Have we got any 4s in the room? 3s, I can see. I've got my chat on my phone, so I'm not being rude. It's just so I can. A bit early for not. Yes, yeah, possibly. Absolutely, yeah. Lovely. 6, yes. Lovely. So using scales like this can really just help us just sort of gauge how we're feeling, and which is a really nice little check-in. So thank you for sharing that, guys. And I will look at the chat sort of after the session as well. So thank you for sharing that. Right, so we're going to move on now to some definitions around health and well-being. So we hear it a lot, don't we, within our organisations, wherever we may work. Lots of us have policies along health and well-being, but the World Health Organization, and I can read it out, or you guys can read it, I'm sure you can read it, it's absolutely fine, but I just want you to just take a second just to read the World Health Organization's view. And if there's any comments, please pop in the box. Okay. And then this next one, and this is all on the slide, so if people want to look at them later, that's absolutely fine. The next one is health and well-being according to sort of the NHS. Very similar in its tones, I think, linking them together. So if you guys want to just have a quick look at this as well. So we took a moment previously just to have a look at the cats and just do a little check-in about how we're feeling, and then obviously we've moved on to the definitions. Is there any is there any points from both of those definitions or other definitions you've seen around health and well-being that you either agree with or disagree with? Any additions to that? Or do you guys have a team definition of well-being? If you can share in the chat or you know, pop your hand up and we can have a quick chat about it. Because it is very different. There's lots of different ideas around health and well-being in particular, and people who you can talk to people from different areas and they will have very different thoughts on what well-being needs. So in order for us to really understand and have a collective sort of agreement on well-being is really, really important. Can anyone define well-being? Hi, Nis.
Hello.
Hiya.
Yeah, I would sort of say that it's important that we look after ourselves so that we can look after others as well. So that's probably one of the key aspects. Obviously, there's lots of different things you can link in, but yeah, I would say that.
Yeah, I would absolutely agree. I think especially in some of the roles, I mean, my background is nursing, but absolutely fundamental. And actually, regardless of what role we do, it's really important that we take time and look after ourselves. I mean, obviously, we still have COVID, and the amount of pressure and stress that is put on us as individuals, our teams, our families. You know, we have a home to go to, you know, and we come to work, and it's very difficult to draw that line. You know, we are one person, we're not different people at home, and we bring those stresses with us to work, and vice versa. You know, we take that home with us. So with the definitions, I think it is interesting that it's hopefully changing and it's coming from less of a deficit point of view, you know, as in like when things start to go wrong, that is when we will implement our well-being process, which has been around for a long time. But it is absolutely, it's more about just, are we healthy and are we happy? And you know, are people there when we're not feeling happy and we're not feeling healthy? It should be business as usual. It should be an everyday thing that we expect from organisations, and checking in regularly with each other, our teammates, and especially in the virtual world, you know, a lot of us still work virtually, so we're on our own a lot. So, and especially if we like people. So, you know, having that physical contact, you know, that chat in the corridor, when you're getting a cup of tea, if we're lucky enough to get a cup of tea, you know, that sort of thing. It's really, really, really important. Any other comments on sort of what well-being would mean to you, or what health means to you guys?
Can I just add something? And you can disagree with me, but regarding the COVID-wise,
Yeah.
I think that before COVID, I think the world was not in a well-being condition at all. I think that comes highlight a lot of the struggles that we were passing before, that we were feeling before. But I don't think that was just COVID-wise. I think that, yes, was a very highlight, new adjustments, and we need to build a lot of resilience around the adjustments and even the isolation of working from home, that adaptations. But I think that previous COVID, I don't think that we were a society that was focused on well-being and mental health, to be honest with you. I don't know if you all agree with that or not, but just coming.
I think that's a really good point. I think that's a really good point. I think, in my opinion, and again, you know, if people have got different opinions, that's great. I love to have a bit of a chat with people around that. Personally, I think it has been pushed back, you know, our well-being and the health of people that work in organisations, absolutely. And I think maybe COVID has been a catalyst, maybe, to sort of focus on that. But I absolutely agree. I think we've not been anywhere near where we should be when you know, thinking about our well-being. Absolutely, that's a great point in that. Thank you.
Ali, we've got a hand up from Raj as well.
Hi.
Hi. Yeah, no, I totally agree. I think it's important we move with the times in terms of our definition, look at the wider where we are sat in society, not just our little society in the workplace, but in our communities as well. But I think one of the key things that I would like to see coming into definitions more and more is to include that thing about connections. Loneliness is a massive factor, and I think you've just mentioned working from home. There's that whole loneliness thing, and it's the same with volunteers as well as paid staff, as well as individual, patients, etc. I think we need to bring in that connections as a key part of health and wellbeing, because we know how much loneliness can impact physical and mental well-being. So I think that seems to be missing on some of the definitions I'm seeing, but it's being talked about almost in a separate way and researched separately. And what I think we need to be doing is incorporating that into that whole health and wellbeing package. And with our work with social prescribing and everything else, that should be part of incorporating as part of almost treatment plans and things. But also for ourselves, we're working remotely. How often are we going to be meeting up face to face? We're not all getting the meeting across the corridor while we're having a cup of tea or making a drink. So I think we need to be intentionally, actively making those opportunities happen, and having even virtual socials. Even in a work day, having that 15-minute catch up over a lunch break or whatever team time you can make. And if you can't do it within the workplace, do it outside of it. But it's got to be something I think we need to intentionally and actively push and promote as a key part of wellbeing. Not just like the mindfulness and the go to the gym and the walks, but I think it's a very important part of wellbeing.
Thank you. Thanks for sharing. Absolutely agree. I think you made some great points. I really loved the words that you use, intentionally and actively. I think we absolutely should be doing that. Some of probably the best conversations I've had is when you're making a quick cup of tea, or you make a tea for somebody, or you're passing them in the corridor, and that's when we would do the check-ins. Are you all right? Oh, you're all right? Having an all right day? Oh no, oh no, it's awful. Or and absolutely those conversations when we are working from home or not going to a base anymore. And COVID has changed the way that we work. There's no two ways about that. But that has been lost potentially. And I think loneliness is a massive factor. And I'll just take you back to, so the NHS around sort of their wording, basically what you said, it does need to be, and they've said it's an ever-changing landscape. And it absolutely is. So I know there's been a lot of media attention around sort of menopause, and which is great. I think that's great that it's out there and we're talking about it and we're discussing it. And I think you are absolutely right that loneliness can impact our well-being, and there's evidence around this. There's research, there's lots of evidence, and it's a big research area. The effects on us physically and mentally linked to loneliness. So I think there's lots of work to do there, as terms of people come to work and with our patients.
Sorry.
I
think we need to be doing that as well, particularly with new starters, bank staff, sessional staff. They can feel very out of place as well. So I think even with the WhatsApp groups and those sort of connections that we have, I think we've got to be aware of those who aren't necessarily there in full shifts as part of the main team all the time. They're still members of the team, and I think we've got to sort of start looking at where their support network will be, where their sort of health and wellbeing will be within the workplace, because we are all responsible for our own health and wellbeing to a huge extent. But as an employer or as an employment setting, I think we can all look out for each other, because if we all work together well and help each other stay well, we will work better as a team to fulfill our work as well. So it's a win-win, really.
Absolutely. Yeah, I agree. And we're talking it through like this, it sounds so simple, doesn't it? It does. I think it sounds very easy to do, but actually it has proved very difficult, and it's proving difficult for organizations. But I think we're expecting more, and we deserve more from the organizations that we work in, which is a good thing. Okay, so moving on from that, thank you for all your comments. Thanks, Liz, for keeping an eye on the chat for me as well. So we hear lots about sort of quality improvement and improvement just as a word. And I've put some examples here, continuous improvement, home improvement, not a big fan of that one, NHS improvement and self-improvement. But actually, if we take the bottom one, sort of the self-improvement, in many roles, really it's the top two that we hear about from our organisations. You know, quality improvement, improving patient care, improving waiting times, starting quality improvement projects so that we're getting sort of from here to there, changing processes. But it just feels like the spotlight on self-improvement and really taking time to find out what we need and what we want and what we deserve is quite low on that priority. Any other improvement linked to improvement that I've missed there that we hear about? And we understand improvement, don't we? We understand it as a term, but we probably don't think about that linked to our own well-being. Or we do, I don't know, it'd be great to hear from some of you. We're always doing it for our patients, it feels like, you know, and our services that we offer and our processes, making them more streamlined, more effective. So if there's no questions. So measurement, again, really, really clear when it comes to quality improvement projects and improving our processes and improving outcomes. Measurement and data, full of that. Wherever I've worked, we've got loads of it. We've got loads. We have a team that gives us data. You know, there's lots and lots of stuff. But how do we measure our own well-being and our own health? Or do we? Do you guys keep a check of how you're feeling? And do you measure your own well-being? And if so, how do you do that?
Can I share what I do as well? I tend to put in my diary. For me, my well-being is very important to go to the gym because I work with people directly support as a psychologist as well. So what I do, I tend to put in my diary every time that I go to the gym, every time that I actually follow my diet, my healthy diet, every time that I did an activity. So I try to plan in advance to kind of not excuse myself of I don't have time. I cannot do that. I'm very tired. Kind of that personal excuses that all of us we try to arrange. So from one week to the other, I plan everything, when I'm going, what time I'm going, regarding my meetings, when I can go, if I can just go after. I'm just planning in advance, kind of to not allow me to excuse myself.
That sounds great. Does that work for you?
Yeah, totally works. And I have some commitment as well because I attend some Pilates groups as well. It's online. So the fact that I have the impact of if we don't have X number, I'm going to affect the others as well. That kind of affects me. So I'm more kind of committed to go and do it.
That sounds like a great, I need to get on that. Definitely linked to the gym. I need to do that. But there's lots of evidence around there when we start sort of exercise programs and things like that. If it's part of a team, if you do it with somebody else or you're in a group, like you said, the pressure, oh, I'm going to let them down if I don't go, will make us go, you know. So there's definitely something in that. And I think planning is great. And it sounds like what you're doing from what you've said is that you are actually prioritizing yourself and you are allowing is a bit of a difficult word, but you know, you are giving yourself that time to say, this is for me and I'm going to do this, because actually we commit to work, we commit to being a parent if we've got children, and we make commitments to everything else. But actually when it comes to us and our own well-being and enjoying ourselves, I don't know if the gym, I don't know, do you enjoy yourself at the gym? People do, don't they?
I love that, yeah. So I'm a little bit the exception here because I really need that. So for me, it's kind of, I really need to go and run. That is my kind of well-being. Something that I try to do as well. If I'm working out of home and I need to drive sometimes, I kind of have that 5 minutes in the car, kind of, okay, this is my mindset here, that finish work. And when I came home, work to be with my daughter and my husband, I kind of thinking now it's time for them. So kind of mobile phone out, work phone switch off, laptop switch off, kind of a little bit of ideas that I put in place, because as I worked 7 months during COVID with my daughter with me all the time, working full time, I was a very difficult time for me. So I needed to find strategies to put in place to allow me for that time.
And I think that's a great, and thank you for sharing that. And I think there is really something in that. And it sounds like it's absolutely, working for you, and it's giving you that time that you absolutely deserve and that you should have. So thank you for sharing that. Okay, so we've spoke about sort of measurement, and it's actually really, I'm not sure organisations are measuring our health and well-being. If anyone has any thoughts on that. And whose job is it to measure our own well-being? Is it a joint effort? And that can be a discussion at the end, really, that when we've got some time at the end. So somebody's sort of spoke, I think you said earlier, about sort of looking after our teammates and, things like that, checking in with them. And often health and wellbeing in organisations is sometimes recognised at the point where there has been some absence, where we're not feeling that great, where or the point where we leave the role due to our health and well-being not being where it should or where we would like it to be. So by this point, by the time we're taking time off because we're not doing very well or we're not feeling well, our health and well-being is affected, it's already too late down that line. We've already started off down here, down a route. So really, organisations, and what we would like to see more of, is that proactive approach. That actually this is business as usual, from recruitment. I think somebody said that earlier, if people are part-time, our students, anybody that is joining our organisation from day one and at the recruitment phase, it is really clear what our health and well-being offer is as an organisation, how we will look after you, what support we have for you before it gets to that point where we have to be taking time off and possibly leaving our roles, which is there's lots of data specifically linked to sort of NHS, and I haven't shared it actually, but NHS and the NMC share lots of data as well about people leaving as nurses and people leaving the NHS and why. And we know that people are really stressed, we're overworked, there's not many staff at the moment, we're having new starters and things like that. All of that, when we come to work, that will affect our well-being, when we're short-staffed and things like that. So how can organisations support that from day one? And have you guys ever had that conversation as a new starter in an organisation from your line manager or from the organisation? Please share if you have. It'd be great news if you have had that. That'd be amazing. Or if you haven't, and if you wanted that, you feel that that's missing in your organisations where you guys work. Have you all had a big lunch? Oh, yay.
Louise has got her hand up, Ali.
Thank you.
Go ahead, Jo.
Hi, I'll fix my camera, by the way.
Oh, yay.
So I think we've recently launched a wellbeing strategy, and I suppose just briefly to say that is one of our aims, is to get that communicated out to the new starters when they start. So we're on it. Brilliant.
And I think that's really, really exciting, And we're not talking, about anything huge, I don't think, for me. It can be really sort of basic stuff. And I don't know, I mean, if you guys have created it, what sort of things does that mean, your strategy? What does that mean?
I guess it's the biggest thing is that it's combining everything that we offer as support in one place, and they will then know where to go to find it and who's the right person to find it from. So it's just all clear in one place.
Yeah, brilliant. That's music to my ears. That's great. Anyone else?
I know we've got another hand up as well, but there's just a couple of comments in the chat. Ali.
Thanks, Liz.
So you've got Sean. I think there's more to do for most organisations. I think most people would agree with that. And then Anna's saying that she works as a restorative supervisor and all staff get one-to-one restorative supervision.
Lovely. That's really good to hear.
Yeah.
That's really good.
I cannot just add something, because I feel that I'm kind of the outsider, because I don't work for I'm here kind of because I work for a private company and we work with transforming care. So with my case, there is a lot of risk involved with people that we support. So one of the things that we do is even on the interview process is involve staff members directly on the interview, doing some role plays to understand if the person can actually cope to work in that setting, regarding the risks of that. But I agree with someone said that there is a lot of things to do here, and it's because of that I'm here, because I have a massive job of improving the well-being inside of my company. So it's because of that I'm trying to grab as much information as possible to understand what we could do different. We do a lot of the briefs and one-to-ones and things like that, but I still think that is not enough, because is different from each person, isn't it? It's so personal centered that for someone could be money, for some other could be mental health, for some other could be lack of support, isolation. So it's just to think more like in a different perspective as a company, what we should put in place to allow people to feel a better well-being working there, and to minimize actually the sick leave time that sometimes we face.
Yeah, and I think that's a great starting point. You know, you hit the nail on the head there where you said it's individual, you know, and I absolutely agree with that. We all have different needs, and sort of when we're feeling a bit of a wobble and different things that can trigger that. So I think you're onto a winner there straight away, and it absolutely is more than sort of standard one-to-ones, or you know, it's more than that, and it's about being proactive. We can't wait. Organizations shouldn't be waiting until people are off being ill and not feeling well, or at a point where they're leaving an organization. It should just, you know, from start to finish, really, with regular check-ins, offering, you know, things like yoga, team building sessions, team nights out, having a coffee session, you know, so then you're covering all different bases. But what's really important is that we're having conversations with our teams. If you're sort of a team leader, team manager, or, you know, whichever role you're in, really, you know, to find out what is it that people need, what can we offer. And as we said, it's not the big stuff, you know, it's often not that. It is just having a cup of tea, having maybe some little exercise, and we're going to go through some positive psychology interventions that may be useful for you guys to use where you are. But also organizations need to walk the talk. You know, we're saying we've released and we're showing we've got this policy on well-being, and you know, we will advocate, you know, this is a great place to work because of our well-being strategy, etc., etc. And there's often different strategies and policies that come out, but it needs to be real. And it needs to be genuine, and we need to believe in it, and it needs to say what it does on the tin. If we're saying as an organisation we will look after our workforce, we're going to support you when things probably aren't right for you, or even before it gets to that point, you can come and talk to us. That is what they, you know, if they're promising that, that's what they need to deliver on. And measuring it, you know, how can we see if those things are making a difference? Often it's because of sickness and absence rates. That's obviously what sometimes organisations go to for that. Sort of retention of staff, if there's a high team turnover or organisations are having lots of people leave and we need new recruits, that they often look to that to say, oh, we're probably not looking after our staff in the way that we absolutely should be. But it could be, we could manage that in a different way. We could measure that in a completely different way, simply by having a chat with the people that we work with. How are you doing? You know, just asking the basic things. Is there anything that we can help you with? You know, is your workload too much? Have you got any strengths? Actually, are you working in an area that, are you currently working in an area that works for you? Or, you know, do you think you'd be better placed somewhere else? Those sorts of conversations. So it's proactive. It shouldn't be at the end when things are probably not going right for us. Okay.
Ali, just want to make sure we don't miss anything. So we had a hands up from Anna and Raj. They've gone down now. Just want to make sure.
Oh
they
no, yeah,
ask.
please.
Either of you want to say anything? Your
Thanks,
hands are down
Liz.
now, but.
Yeah, no, I was just, you sort of went on to the retention and sickness and things like that, which is absolutely true. But in terms of some of the things that we've sort of brought into one of my organisations, is we've got obviously the mental health first aiders we've sort of had before, since even before the pandemic, which was fantastic. So we take it as part of health and safety. We as an employee have a health and safety commitment, and this particular organisation that I'm thinking of that I'm involved with, we've been really proactive in the sense that we class that as emotional well-being and mental well-being, not just physical health and safety, which is how most people interpret it. But if you actually look at the Health and Safety at Work Act since '74 or whatever it was, it doesn't specify, it doesn't say only physical. So realistically, we should all be doing that anyway, looking out for the whole person at work as an employer. But we've also got buddy systems. We've got mental health first aiders, so people can approach them not just when they may be in a critical point or a crisis point, but it's also just to have someone to go and say, can I have 5 minutes? You know, there's people who've got time allocated to say, it's an open door, these are the times we're available. You know, if you just want to come in and say hi or just have a bit of space away from everywhere else, come and sit down, come and have a chat. You don't have to talk if you want to, but we're here if you do. So people as mental health first aiders and buddies are actually allocated, and there's times allocated. You know, around breaks or whatever that people can do. But there's also information that's given out, like signposting. So if people want to do things anonymously, there's obviously the phone lines, and that sort of information is available and visible everywhere, but people can be discreet as in when and where they do that. But it is that proactive approach. It's making it as easy as possible for people to access support in-house, whether it's a person or whether it's a resource or whatever. But I think the other key part of that check-in is enabling those quiet spaces, which I know can be really, really difficult. But also we have wellbeing days. You know, if people need to have those mental health days or wellbeing days, they're not frowned upon, they're not judged upon. If people say they need to go for a certain reason, because jobs are really stressful, that, you know, working in the world of work that we do, you just need that. You need to take that time out sometimes, don't you? And if there's an understanding that someone is going to do something and there's a procedure in place, then it's okay. You just accept that somebody might need to take that few minutes out. But it's got to be part of the systems and processes as well. So there's a two, you know, we've got to do it on a strategic level, but we've also got to do it as teammates, looking out for each other. As well as sending that information and making it available. If it's invisible and it's just stuck in one place, I mean, you don't always want it just in a staff room, because sometimes your stress might actually be rooted somewhere in the staff room or something, you know. So obviously, like, toilets are really good places to have stickers, etc., even leaflets and things, but they can all be mixed up, and you can have it under health and safety, so people aren't self-conscious. It's just a mental health thing, for example. It's about being creative and supportive and not drawing attention if somebody doesn't want it to be drawn attention to. It's enabling that sensitivity and discretion if people want it, because people are still very fearful of saying that if I've got a health and well-being concern or challenge at the moment, they don't necessarily want to tell the boss because they feel it's going to go in their record and be penalised for it, or they'll be judged for it. And we've got to turn that around. We've got to change that mindset and actually say, no, we're here as a nurturing employer, we're here as a nurturing team, and we look after each other, because if we don't help each other stay well, we're just going to take the stress home and it's just going to bring it back again, and it's not good for society at all. So it's about making it accessible and safe for people. It's that psychological safety that I harp on about. You know, it's making the place safe enough for people to actually feel they can actually share that stuff as well.
Yeah, great points there. Great, you know, and psychological safety. I mean, we're not doing a session on that, but I could talk all day about psychological safety. So important that we've got that open dialogue where we work and we can say how we feel. We're safe to raise, you know, it is a safe environment where we raise our concerns, and we're not going to be seen as a troublemaker or, you know, and all those different things. So yeah, I think that's a great point. I actually read a really interesting article around wellbeing and health and safety the other day, and I was going to add it as a resource and I didn't. So if I find it, I will pop it over. You've probably read it, Raj, but it was great. It was really, really interesting from a health and safety point of view. It was a great article. Really, really interesting. Yes, yeah, I will pop it over to Liz, and Liz, if Liz can forward that out, because it was really, really interesting. Anyone else? Any comments on that? Any other organisations doing sort of similar things and the things that Raj spoke about? Because some of those things sounded great, you know, as you said, it's keeping it informal still, sort of, you know, in the toilets and things like that, which is great.
Lots of nods on camera there, Ali. Lovely.
Right, so we'll move on. Again, thanks for all your comments and your points on it, because it's a real lift to know that actually there's really good stuff going on out there, and you know, and we are working really hard. And I can, whether it's the Friday feeling, I don't know, but I can feel a change is coming. Honestly, I can, because we cannot carry on the way that we were going. We need to look out for each other. So we're going to have a very whistle-stop tour. I'm just keeping an eye on the time. It's 22, so we've got a bit more time, around positive psychology and interventions. You might have heard sort of positive psychology. Obviously, we're familiar with the term psychology, but this is slightly different. So it is around sort of flipping negative bias, focusing on strengths. It is an academic field, lots of research, evidence-based stuff going on around this. And it's a proactive approach to our well-being as well. And lots of organisations and individuals are really sort of taking on board bits and pieces around positive psychology. So it started, I mean, really, it kicked off really about 25, 30 years ago. But the term positive psychology first came from Maslow, you know, Maslow's hierarchy of needs. So we're familiar with the triangle, yeah, the basic needs and all that. So he was the first one really to talk about positive psychology. And then it sort of went away. And then there's a guy called Martin Seligman. So he was the president of the American Psychological Association, and he was made president back in, I think, 1998. He'd been a psychologist for many, many, many years, and sort of he gave this speech when he was made the president, and he basically was saying that psychology is half-baked, and that is if you're interested in Martin Seligman and positive psychology, he's got loads, just Google him, and he's got some really, really interesting sort of TED Talks and stuff like that. But he was saying actually what we've been doing in psychology is always sort of we're fixing people that are struggling, you know, lots of trauma and things like that. So his idea was actually, let's switch it. And don't get me wrong, it's not all happy clapping positive psychology, you know, it's definitely not that. It's about recognizing that our lives will go like this. We will all have good days, bad days. We will all have you know, ups and downs, times to rejoice, times to celebrate, and times to grieve, and times to be sad. And that is life. But positive psychology sort of, and I've put them down here, focuses on things like gratitude, which is immensely powerful, and we can really use that in organisations. Lots of evidence-based stuff around that too. Savouring, so really taking that time. If we're having a cup of tea, if we've got 5 minutes, links really in, it can have links to sort of meditation, really savouring. So just taking your time, being at one with drinking a cup of tea, how's that tea feeling? What does it smell like? All of those things. So you're really just focusing on, because life is so busy now. So often we're grabbing a sandwich, we're sending an email, you know, we're sending the kids off to school, we're trying to brush our hair, all of those things. So savouring can be really powerful. And I've put links to things like this in the resources. And this is stuff that we can introduce into the workplace that can help our workforces and us as individuals. So optimism. It's not always easy, is it, to be a little bit more optimistic? And again, positive psychology is not just thinking everything's great, you know, I'm going to ignore the bad stuff. It's not about that, but it's actually about training ourselves and doing work on ourselves to probably look for the optimistic avenue rather than going down, oh my God, it's all doom and gloom and oh my goodness. So it's around that. Our strengths. So there's free strength stuff that you can do. There's loads, and I've put the link in, that you can find your own sort of strengths. And consider your own values as well. Really take time to think about what strengths we possess as well. Does that align with the work that we're doing? There's evidence to say that actually when we're in a job that we're using our strengths, we're happier, we're joyous, we do a better job. So actually that could be something that our work could introduce in our one-to-ones and things like that. And biggies in positive psychology, again, is kindness and empathy. And I would hope, you know, and we, you know, we all really try to be kind and have empathy. But the gratitude thing is, it is really evidence-based, and the good thing with gratitude is that it grows. So it's sort of like paying it forward, really. We're grateful, we pay it forward, and it just grows and grows. And there's lots of evidence around societies and communities where gratitude has been extremely powerful. Gratitude intervention, so PPIs we call them, we're not getting any money back, they're just positive psychology interventions, so you might see PPIs dotted around. One around gratitude is 3 good things, so that focuses at the end of the day or at the end of a week, we write down 3 good things out of our big day. I do it with my daughter before she goes to bed. Me, my husband and my daughter do it at bedtime. So regardless, you know, you could have had the day from, but it just really makes us just focus, recenter and think about things that we're grateful for. So that's a really nice little one to do, really, really quick. So that's really, really good. Another one is remembering when you're at your best. That's a great little intervention to do. If you've got people that are coming back from mat leave or long-term sick, it really helps with confidence, and you get them really to think about, to remember a time when they were at their best, how that felt physically and mentally, and what were you doing. You can dig a little bit deeper with that as well, but that's a great little exercise for you as well. You know, if you're feeling a bit cheesed off and we're not at our best today, that's a really good exercise. Takes a couple of minutes as well. So they're just little snippets, really. But as I said, they're effective and they're evidence-based. So it's not some wishy-washy things. And there's loads of stuff on the internet about it. And I've put links to Authentic Happiness, which is Martin Seligman's. It's the Pennsylvania University. Loads of little things that you can do on that to find your strength. They're all free as well, which is lovely. Yeah, and we can do these for ourselves, but we can also introduce these to our workplace as well, which is exciting.
Got a hand up there, Ali.
Yeah.
I was just thinking about what you said, because I bought for my daughter, there are some cards that is positive affirmations. So she takes every single day 1 card and we talk about that, things like this. And I thought, because most of the places that I work, I think that is because of the high risk for the people that we support. Sometimes it's a wall of negative feelings. So this day was very negative. I could not do anything. Nothing was positive. We have an incident. And I think that sometimes it's you are stuck in negativeness more than actually positive things. It's more likely that you're going to remember that specific negative situation than actually, but in the end I did that, or I made it. So I was thinking, it was funny that you said that, because I was thinking to create for each of the place that I work kind of that card. So each person should create a card, like the cards of my positive affirmations that they could take and kind, yes, was a bad day, I had incidents, but in the end, this, let's talk about that, kind of as a debrief for staff, because it's really hard to find sometimes positive things in the middle of such a difficult environment, isn't it?
Yeah, I think that's a great idea. I think that's a really lovely idea. And again, they're quite simple, but when we work in demanding areas that, you know, if around trauma, it doesn't matter really where we work, really, to be honest. But trying to find that little bit of goodness that, you know, from your day, it's, you know, it's a great little exercise. Or you say the affirmations, you know, all of that can be really, really good stuff. So thank you for sharing that. So now I'm going to, again, this is a Martin Seligman. It's been around for a while, actually, the idea of flow, since sort of the 1970s. But Martin Seligman has really sort of brought it back to life. And I've just put this up here, but flow is really about, if you guys can think about something that you do, an activity, a hobby, something, or even work, actually, you can have flow in work when you are absolutely in that zone. Time goes, you're not talking to anyone, you're enjoying it, and that is flow. So if anyone's got an example of something that they do and they feel like they're in flow, that'd be great to share. But I've just put this quote up here. So there is one aspect of happiness that's been well studied, and that's the notion of flow. Ask yourselves, when for you does time stop? When are you truly at home, wanting to be no place else? And we can bring that into work. You know, there's probably areas of your job that you might love all of aspects of your job, but there's probably bits that you think, you know, I really enjoy doing that. So it's not just something like going to the gym, riding a bike. It can be, but actually we can have flow at work. So that, you know, that could even be something that we discuss with each other. You know, how do you get your flow? Does anyone have any comments on flow? Have they heard about it? Have they had it? Have they been in flow recently? Yeah. Gardening, yeah.
I tend to, I love my work where I'm working with people and I'm in my flow, basically. I'm in my element, when I just absolutely love seeing people have that light bulb moment where they transform. That, you know, they could be having a really difficult, challenging time, and through the work, you know, whether it's coaching, counselling, mentoring, whatever hat I'm wearing at the time, watching them go through this process and go from absolute despair and overwhelm and all the rest of it, and just that transition, and seeing that person be really empowered and self-empowered and just go into that change, and seeing a light at the end of the tunnel, working out solutions and steps and how to progress to whatever they need to do to change. To me, that's where I find my flow. There's no other place I'd be at that moment than to see that person go through that and work out through with them so that they have that life transformation. And to me, in the workplace, that's a huge thing for me, and that's why I've been doing this work for over 30 years.
Wowzers. And that's great. You know, that's great to hear that you've got a job that you enjoy and you can absolutely very quickly pinpoint and express why you love what you do. You know, and it's lovely.
It's paid and an unpaid capacity, but in different areas. You just get that buzz of that community involvement and just transforming lives. It's amazing, and watching people's lives transform is the key thing for me.
And you, again, you know, you've made a really good point. Often organisations and just in our lives, it is not about the money, the big bucks. You know, yes, it helps. We all need money, obviously, and I understand that and appreciate that. But actually, it's how we're treated at work. Are we valued? Do we enjoy our jobs? You know, do we get satisfaction from our jobs? Have we got a great team? Are we supported? So I think they're great points as well. Thanks for sharing that. It's lovely to hear that people are loving their jobs. I love that. So I'm coming to the end now of our session. So we've got a few more minutes just for some questions, but I just wanted to leave you with this. And, you know, I think it's more important than ever, you know, just to take care of yourself. You know, you're the only you've got. So let's look after each other as well.
Thank you very much, Ellie.
You're welcome.
Thank you. Any questions from anyone? Then I have one, if I may.
Yes.
I suppose not a challenge, but what you were talking about with measurement.
Yeah.
So, you know, I think the sickness one is the obvious measure for lots of organisations. But I think what you said about actually measurement by conversations,
Yeah.
I'm just wondering, sort of at board level or senior level, how that fits and actually what the response would be. You know, well, I've had this many conversations, and it's the so what bit. So just interested in your thoughts on that, really.
Yeah, I mean, there's tools out there. There are tools to measure our well-being, and I suppose, if I'm honest, I would probably go out, you know, at board level, you know, if I were you, and just actually say, how do you want us to measure your well-being? Actually, you know, as the people that work for our organisation, because it's not about the numbers. It can't be about that. There are, as I said, there are tools that we can measure that, and, you know, getting feedback from people. Do you feel like you're valued? Are you happy working here? You know, it can be really simple stuff. Yeah, they're on the resources. I've popped them on. Yeah, I've popped them on. But I don't, if I'm honest as well, Liz, I don't think we know how to measure well-being well yet. You know, I honestly don't. I think we're definitely starting those open conversations about well-being, but it can't just be about sickness and absence anymore. I haven't got the answer for it, but I think a good starting point may be to ask people, how, you know, are you happy? You know, is there anything more that we can do to support your, and somebody made a comment as well about individual well-being. So what's, you know, what do I really like doing? Let me think. You know, so I really like singing. You know, so to put me in a room and have some music on, I'd love that. But it might not be for someone else. Sorry, I'm seeing some. I can't see the chat.
So I was, yeah, so Sarah's just put about how do I access the resources from Northamptonshire. So what we'll do is when we circulate the slides, obviously we'll include those resources as well, and we'll put them onto the website with this recording. So you will be able to access them, Sarah, don't worry.
Yeah. I've put a few on there, and there's links and stuff, so you know, just to go and explore. And what I didn't touch on really, and I had a conversation with Liz this morning about it, is finding joy at work. Again, we hear that, but having fun, you know, having a laugh, bit of humour. You know, we all, work can be stressful in whichever area that we work, but you cannot underestimate the power of a giggle or some humour or just getting together for a cup of tea.
Thank you. Any more for any more? No? Okay, that's great. Ali, thank you very much for your time. Thank you all as well for coming on Friday afternoon. Have a lovely weekend, and catch up with you all soon. Thank you, Ali.
Great to see you all. Have a lovely afternoon. Take care.
Lots of cues coming through.